J. Bhattacharya, brilliant Stanford University medical professor who blew the whistle on COVID lockdowns, and then they tried to crucify him. In these brilliant and broken science videos, we'll be looking at controversial scientists who are ultimately proven to be largely correct, and most importantly show how the systems of science, instead of welcoming dissent, tried to crush it and essentially acted anti-scientifically. So you'll remember it well, the fear of that initial COVID outbreaks in China, the shocking images from China and the predictions of massive deaths, and then the lockdowns, and then more lockdowns, and the labelling of anybody who opposed them as killers. Well, for a long time, the accepted approach to a pandemic was not to lock down the economy. It was to do what ultimately the Swedish did: take many precautions to limit and slow down the transmission, and take a special care with the old and the vulnerable. In the end, it was always impossible to prevent the transmission, and the concern was always that the lockdown would cause more harm than the disease that it failed to control. This was what J. Bhattacharya said. We were especially damaging the children, who ended up being totally unaffected or almost totally unaffected by COVID, and we did this to save the old. The opposite to what we normally do. It's actually the duty of the old to protect the young. This was J. Bhattacharya's message early in the pandemic.
The harms from the lockdowns.
Yeah, what do we know? What do we know?
They're tremendous, and we're still beginning to count them. Right. So domestically, for instance, I think there's now a broad consensus that the lockdowns harmed our children. In many places, including California, children did not see the inside of a physical classroom for nearly a full year and a half. The consequences of that play themselves out with deep learning losses, by the way, concentrated on minorities and poor populations who didn't have the wherewithal to replace the lost in classroom learning. But it plays itself out over a long period of time. The social science literature from before the pandemic had documented in detail about how valuable investments in education are for the health of children. If you deprive children of education for even short periods of time, it turns out, it leads to a lifetime of lower income, worse health, even shorter lifespans. One estimate from early in the pandemic, published by the editor of JAMA Pediatrics, found that just the spring lockdowns in the United States alone cost our children 5.5 million life years in expectation. That's yet to come, but it's coming. The toll on skipped cancer screenings, and again, starting to see it, but the full extent of it is yet to come. In the poorer parts of the world, the consequences have been absolutely devastating.
His research group did some very early work on death rates, which showed them to be much lower than feared, and thus the lockdowns, especially children, was not warranted. So with Martin Kulldorff of Harvard University and Sunetra Gupta of Oxford, he wrote the Great Barrington Declaration, which argued that current lockdown practices are producing devastating effects on short and long-term public health. The results, to name a few, include lower childhood vaccination rates, worsening cardiovascular disease outcomes, fewer cancer screenings, and deteriorating mental health, leading to greater excess mortality in the years to come. With the working class and younger members of society carrying the heaviest burden, keeping students out of school is a grave injustice. The people of the Great Barrington Declaration argued that for focused protection, essentially protecting for the older and infirm. Now that the epidemic is over, it looks like Bhattacharya got it mostly right if one compares the excess death statistics of countries or jurisdictions that were very harsh with lockdowns to those like Sweden that essentially did what Bhattacharya was advocating. So this data shows Europe. Sweden did very well, but did not end up with the massive debt that, say, the United Kingdom did, which will ultimately cripple its healthcare system for decades. And because that country did not shut down, Sweden, the problems with missed cancer screenings and mental health problems for children, which will not be felt for many years, well, these will be probably largely avoided. But the point is not that Bhattacharya was right, or mostly right, or even just partly right. The problem is the way the scientific community treated Bhattacharya. Science should ideally welcome debate and argument, as this sharpens the ideas, subjects them to challenge. If an idea survives the challenge, it emerges stronger and more reliable. But that's not what happened in a depressingly familiar story that indicates there are many things we can do to oil the wheels of science and stop the groupthink bullying mentality taking over. In Bhattacharya's case, he was first shocked to find that Stanford University started interfering with his research.
But Stanford made us change, after the fact, made us change the protocols of the study. It was unprecedented. I mean, I've been a Stanford professor for 20-some years up to that point. I've never seen or heard of Stanford forcing professors to independently change the results or change the protocols of a study after the data collection had already been done.
Then Stanford attempted to stop him to even defend his position.
Stanford then, when we found this out, when I immediately noticed that the denominator was wrong, I pointed this out to the folks at Stanford in the medical school that were forcing us to change our protocol, and they told us we were not allowed to tell the world about it. At a time when people were questioning the accuracy of our test kit, the correctness of our study, and so on.
Stanford did not allow Bhattacharya to give seminars at the university to explain his science. So as he wrote in the tablet, "Though I have given dozens of talks and seminars at Stanford over the past decades, in December 2020 my department chair blocked an attempt to organise a seminar where I would publicly present the ideas of the Great Barrington Declaration." He actually even feared for his safety when a campaign of protesters spread a whole bunch of posters around the campus. He said, "On a progressive-dominated campus, these posters were clearly an incitement to violence. The group placed them on kiosks all over the campus, including near campus office shop that I used to frequent. For a few days, I feared for my physical safety. I reported this harassment to Stanford, but the university minimised my concern, referring me to a counsellor. Well, that will work, won't it?" The university should have publicly supported Bhattacharya's right to free speech and encouraged a debate and actively stayed out of taking sides. But the worst came when the scientific health authorities, tried to smash his reputation and that of the Great Barrington Declaration. There was no attempt to argue his scientific points. It was a pure, straightforward scientific mugging.
Dr. J. Bhattacharya of Stanford, Dr. Martin Kulldorff of Harvard, and Dr. Sunetra Gupta of Oxford. We now know that just 4 days after you published the Great Barrington Declaration, Dr. Francis Collins, director of NIH, wrote an email to Dr. Anthony Fauci, director of NIAID. Quote, "This proposal from the three fringe epidemiologists," let me just repeat that, J. Bhattacharya of Stanford, Sunetra Gupta of Oxford, and Martin Kulldorff of Harvard.
So they were labelling him as a fringe scientist, argumentum ad hominem. They were playing the man, not the ball.
This proposal from the three fringe epidemiologists seems to be getting a lot of attention. There needs to be a quick and devastating published takedown of its premises. Close quote. A week later, Dr. Collins spoke to the Washington Post about the Great Barrington Declaration. Quote, "This is a fringe component of epidemiology. This is not mainstream science. It's dangerous." Close quote.
Bhattacharya sums up why they needed to destroy him and the Great Barrington Declaration and those hundreds, thousands of scientists who signed it, because otherwise they would have a great deal of trouble implementing the most draconian civil lockdown measures or civil orders totally since perhaps the war.
The problem was for Tony Fauci and Francis Collins was that they had to solve a PR problem. You have prominent scientists saying, look, what these guys are doing is not actually the right strategy. That normally should have led to a debate. a discussion, some sort of like conversation. But because if you're going to implement a policy as devastating as a lockdown, you actually need to have scientific consensus. It's not okay to say that we should lock society down when only like part of scientists agree with it, especially when it's clear it didn't work in just a few months earlier.
That's right.
And it was already clear that it caused a lot of damage a few months earlier. So they faced a PR problem. They had to make us into fringe characters, fringe actors, destroy us, destroy our reputations, so they didn't have to have that debate. They needed to create an illusion of scientific consensus that did not actually exist.
Well, that sums up the way much of public policy science works nowadays, and it's not science.
It's very clear from how scientific institutions responded to COVID that science is fundamentally broken.
So Bhattacharya risked his entire career and he went through hell. You can get a measure of this man by his pursuit for truth, no matter where it would take him. A true scientist and a brilliant scientist. But I also want you to see this to get a measure of Bhattacharya as a human.
You served as an expert witness in any number of trials. You've now spoken at different conferences and events. And I'm delighted that you've made so much money. You have refused any payment whatsoever as an expert witness, no speaking fees, zero.
Yeah. I don't feel right taking money for my COVID work.
We're very lucky that the world has people of the quality of Bhattacharya. Now, it's easy to get depressed about all this, but I'm certain that there is now a widespread realization that we have a problem with our science institutions, and that's the first step to finding an ultimate solution. And despite the hopeless deficiencies in the way that scientists has worked with COVID and now other things, the fact that Bhattacharya and his colleagues were still able to, albeit with great difficulty, to get the message out, that never happened and can never happen in China. So I'll be continuing this short series on summaries of brilliant and broken science, so please like and subscribe. I'd also be interested in suggestions and comments of other brilliant scientists who were also crucified in the past.